benefits South Sudan Medical Student Association, Egypt, can make in South Sudan and in Africa. And the person who will give us this will be Dr. Nihal. He's a research assistant professor at Brown School at Washington University in St. Louis, sorry. Dr. Tutlam earned his Bachelor of Science degree in biology from Tennessee State University and both his Master of Public Health and PhD degrees from St. Louis University. He's the Chronic Disease Epidemiology Program Manager in the Division of Health Promotion and Public Health Research at St. Louis County Department of Public Health, where he oversees chronic diseases and mental health surveillance. He's also the project director for Project Restore, a 4-year, 1.7 million minority youth violence prevention project funded by the Office of Minority Health in the U.S. Department of Health and Human Services. In addition, Dr. Tutlam is an adjunct instructor of epidemiology at the Brown School at Washington University in St. Louis and teaches a chronic disease prevention course at Linwood University. His research interests include chronic diseases, maternal and child health, and intergenerational impact of war trauma of South Sudanese. He also worked with his mentor, Dr. Teresa Betancourt, as part of the Youth Forward U19 NIMH grant in Sierra Leone. His co-authority, the paper applying the exploration, preparation, implementation, sustainment for framework to testing strategies for scaling evidence-based mental health interventions in fragile and low-resource settings, an example from Sierra Leone. He has taken on the leadership in data analysis writing results. We are so pleased to have with us today Dr. Nihal. We are so excited and we are looking forward to hear from you on guiding us on how we can contribute and benefit all my Africa at large. Welcome, sir.
Thank you very much, Miravka, for the kind introduction. Really grateful and honored to be part of the program today. I always, this part of the work that I enjoy so much, interacting with young people who are coming up and learning about research, about medicine, about all kinds of things that are directed toward helping our society, and really honored to be here. And really also honored to share the platform with such incredible mentors that you have both in Cairo and abroad. Dr. Akuya Samba, Dr. Seth Bloom, those are our dear friends who've been friends for 20 years. And it's really good to see that we are supporting your work. I'm very, like all the speakers have said, I'm very impressed with the work you have done. It's not an easy thing to pull off this kind of a thing where you have people from different time zones and different continents and to get them together. So really, congratulations on this remarkable achievement. I have a few slides that I would like to share if I have the privilege to do that. It looks like I can't do that. Do I have the privilege to share? Can somebody give me those rights?
Yeah, sure.
If you can make me a host, I may be able to share my slides. If not, I think I sent them to Alafi just a couple of minutes ago. You can.
You've been made a host, so you can
Okay,
share
good.
this.
So okay, wonderful. Then I can share my slides. Wonderful. Can everybody see my slides now? Everybody can see those? Wonderful.
Yes.
Yeah. So, okay. So I've been asked to speak on the contributions and impact this wonderful group of young people can make back in South Sudan. And to do that, I just want to give you some sort of a brief overview of my journey, so that at least some of you who are sitting in these chairs thinking, when is it that I'm going to the place where I'm going to get to, you may be able to pick something from here that is useful. I know your professors have given you some really, really useful advice, and I would encourage you to hold on to those words. But, you have to start from somewhere. So personally, I started when I came to St. Louis many years ago to join graduate school. So even before I completed graduate school, I got a job as a research assistant at Washington University School of Medicine in the Division of Infectious Diseases. So that's where I started my research career as a researcher, doing data collection, doing data analysis. Then later on moved on to a study coordinator role, where I was involved with everything from recruitment of participants all the way to the data analysis and that to that point. And then I decided to go back to for my PhD program to get a PhD, so that then I can work on my own research questions that I am interested in as a researcher. Because, when you're a research assistant or you're a research coordinator, you're often working, and there is nothing wrong with that, you're often working on other people's projects, other people's interests. So somebody has a very interesting question, research question they're interested in. They seek funding for that, and then they hire research assistants to make sure that that work is implemented. So I wanted to answer questions that are really of interest and important to me as an individual. And we'll see some of those shortly, and some of those really are informed by my own experience as well, lived experience. Then after my PhD program, as you mentioned earlier on in the introduction, I got a position to lead the chronic disease epidemiology program, which was sort of a new program we were just setting up to do surveillance in the county. St. Louis County is the largest county in terms of population in the state of Missouri, with about 1 million people. And so we needed, chronic diseases, 7 of the 10 leading causes of death in this county, as well as in the United States, are chronic diseases. And so we felt it was important that to have surveillance of that. And obviously mental health is part of that. And then went back, left that and became a postdoc at Washington University. And now recently I transitioned to a research assistant professor position. So I'm on faculty at Washington University now, mostly doing research. I don't do teaching a lot anymore. Most of my research is currently focused in Uganda. Literally, I've been on Zoom since 2 a.m. this morning with some of our team doing training in the refugee camps in northern Uganda, training some of our research assistants who are going to do data collection. Because I'm not there, I've been joining the trainings by Zoom, so I've been up. So if I look sleepy, that may be the problem, but I'll try not to fall asleep during this talk. And then, so I just briefly to show you here from some of the publications from the work I've been involved in since the time I was in graduate school and right after graduate school. And I have some of my newer work now, which I'll touch on. I'll touch on some of the work I'm doing to show you what it is that you can do to contribute to some of the problems, some of the challenges we are facing back home. So I don't need to tell you all that South Sudan has been a country in crisis. We all know that. Some of us have lived in this crisis longer than some of you. Some of you were probably born very recently. But just simply stated, South Sudan has been at war since 1955, and that's a fact of life. So that war ended in 1972, and then we went back to it again in 1983. It took another 22 years to end that. And in most cases, when we say ended, it really hasn't ended, right? Because we still have violence in some parts of the country. Every now and then, insecurity is a problem. And I'll show you why this is a problem related to our public health. And of course, we've had our own issues internally as South Sudanese, even during that North-South conflict. And then in 2013, we also had our own conflict right after independence, where, you know, it's estimated that we've lost about 400,000 people. And you can see the sort of the stress that it puts on it, and the damage in terms of the social fabric of the society, in terms of the infrastructure that is destroyed, so that then you don't have hospitals to be able to take care of people, then you don't have schools to train people like yourselves to then take care of the sick individuals in our community. So you can see what I always tell people when I speak, literally the last 3 or 4 generations of South Sudanese have been exposed, have experienced some sort of trauma, which by itself is a big problem, right? And I'll show you what we mean by that. So what does conflict do to a society, right? So there are people smarter than I am have looked at this and, you know, come up with this schematic to tell us what it is that usually happens when there is conflict. And I'm hoping that people can see those slides. And so you have conflict in the outer circle here, and some of the things that happen as a result of conflict. So redirection of resources towards a war effort. So usually governments, the first thing they do is go buy big tanks, buy big weapons and all that to, you know, prosecute the war they're engaged in. And so guess what suffers in that regard? So I do not have resources or money to build a clinic or to train medical students like yourselves and all that. So you are redirecting resources towards this effort that, you know, the people in charge, usually that is their primary focus. That's what they're interested in. The malarias of the world, the diarrheas of the world and all that become really irrelevant issues for them, even though these things go up as a result of conflict, right? So you can see as a result of conflict, infectious diseases. I don't know if you follow the news from South Sudan. I think the largest cholera outbreak in the recent past happened in our country. So that's a problem as of conflict, right? Mental health suffers. Nutrition becomes really a problematic issue. You know, you see all these malnourished children and all that who are fed by whether it is UNICEF, whether it is the World Food Program and all that. We have to rely on other people to basically take care of our own people. So these are problems that can happen as a result of conflict, and it directly relates to what it is that you are doing right now as individuals and as professionals. So what happens directly? So we know that infant mortality rate is usually one of those key indicators, and I'm grateful Alafi talked about some of those epidemiology. You know, he was speaking my language earlier on. These indicators of general population health, right? More infant mortality is one of those key indicators, right? How healthy is your society? If your children are dying before they reach the age of 5, then you know that there is a problem. And we happen to lead, you know, many countries in this very, very ominous statistics, right? So South Sudan has one of the largest infant mortality rates in the globe. I think it's so for every 1,000 babies that are born, 102 of them die. And this has come down significantly, by the way. This is an improvement, but it's still very, very high. Right, under 5 mortality, still about 99 per every 1,000 live births. So there is no reason that 99 out of 1,000 kids that are born should die, you know, and I'll show you some of the causes, and some of you are aware of these, that some of these children are dying. And then the biggest thing here is that, you know, when I was going back to the PhD program, I think the statistics that jumped out of me was 2054 mothers. So this is a maternal mortality ratio per every 100,000 people were dying in South Sudan. At that point, I think it was the highest in the world. And it's also improved significantly, but not nearly enough, right? Not nearly enough where we need it to be. And part of the problem is basically, you know, this lack of resources and lack of adequately trained workforce, which is, I'm relating this to what it is that you're doing, what it is that you can contribute towards addressing some of these problems in our motherland. So we all know, and I'm glad you guys have a very, you've put your finger on some of these key issues. I think what your professor was speaking earlier on, picking on these research topics that are important to you, right? So if for your conference here, you've picked, this diarrheal diseases, and that is really critical, right? So you can see, I have graphs here from the WHO in terms of what are these leading causes, or what are these things that mothers are dying from and the kids are dying from at the very early age. So this is causes for under 5 mortality, and you can see that about 12%, of that children that what's killed is really this diarrhea. And so this is really crucial, and I'm glad that you picked this as one of your topics to discuss. And you can look at some of these other things that mothers are dying from, it's hemorrhage, and infections, hypertensions and things like that are killing mothers. And as I said, as I see, you may be able to see from the slides here, about 75% of child deaths in South Sudan die from preventable causes. Think about that, 75% of all these deaths. So also, I think put another way, 75% of these children who are dying should not be dying. That is what we are saying here. 75% of these children who are dying should not be dying, because we know how to prevent the causes that are killing them, the diseases that are killing them. And I would argue that part of that problem is, this lack of capacity in our country. And lack of capacity has nothing to do with you as individuals. It is lack of capacity because we've been at war so much. We haven't even had enough time to train people. So now you see most of you are being trained outside of South Sudan. South Sudan itself now trains some doctors, but not nearly at the rate at which, we need these individuals to be trained. So as you are getting your training, your mind, and I'm glad, you guys are calling yourself South Sudanese, your mind is still focused in terms of what it is that you can do back home. And I think that is part of the reason why you wanted me to give you this talk. What is it that you can do? I think you are doing the very first thing that we actually need to be done, and that is acquiring these skills to address some of these problems. And so I want to applaud all of you who have taken on this challenge, because it's not, as has already been told to you, and I don't need to tell all of you, it's not easy, right, to do this work, to undertake, to be able to decide and say, hey, I am going to be a doctor to help save lives back home. It's a decision that you make on your own or with your family, but that's a decision that will have a huge impact on the general society. And so really, really appreciative of what it is that you're doing. Another thing that I wanted to touch on here, and it relates to what it is that you can do, and it relates to that lack of capacity, is that, South Sudan has been at war, like I said, since 1955, right? And what generally happens, I showed you one of the slides earlier on. One of the things that happens in terms of what gets affected by conflict is this mental health of individuals, right? And so we have a population, literally a population that is traumatized with all these mental health issues from this exposure to war trauma for many years. And I show you data here and statistics from all sorts of places. These are all studies from different war-affected populations. Some of the common disorders that come from war trauma, anxiety, depression, PTSD, and you can see the rates there. Never mind the wide variations of those that we can get into why there are these variations. Some of it may be the instruments they use to measure these things and all. But the point here is that there are very high rates or high prevalence in these communities or these societies. You can see here in South Sudan, we are right there in the middle of these things because we've also experienced this war in terms of mental health disorders. This is from a paper, a meta-analysis that we just I published last year, and that shows you here there. So in terms of the populations within South Sudan, if you just look at them in terms of mental health, PTSD prevalence, just PTSD alone, you can see somewhere around 40%, almost, more than a third of the population of the, at least the people who were in these studies. And then you can see in terms of those who are in the refugee camps, almost 40% again. It's slightly lower when it comes to these are called resettled refugees. Part of this reason is, there aren't enough studies that have been done in these resettled communities. Those have been resettled in the West, the United States, Canada, Australia, and places like that. And we have questions about the quality of some of those studies as well. But you can see that, the bottom line is here, the rates are, or the prevalence is really high in terms of these mental disorders. And what concerns me also as a researcher usually is that there is this idea that the impact of this war trauma in terms of mental health outcomes is really not just the people who have experienced the war. It also can affect the next generation, this idea of intergenerational transmission of trauma. And this is what my PhD dissertation focused on. These children can be affected. And so like these children who are even not even born in the conflict zone, they were born in the United States, presumably in safer situations, still have these emotional and behavioral disorders. And so you can see, just picking two topics of in South Sudan that are affected because of the conditions that we are in. And then the biggest problem that we also have is lack of access to care, to medical care, right? So you've probably likely seen the statistics. Less than 50% of the population has access to healthcare. Part of it, I would argue, is lack of this skilled, trained professional workforce that can actually deliver that care to these individuals back home. And then there you see severe shortage of trained workers. And if some of you are very familiar with what happens at home, most of our healthcare services right now are delivered by non-governmental organizations, these international NGOs, MSF, IRC, UNICEF, and all, you name it, all so that, even the government itself, what it does is really, I would say bare minimum, right, to provide these services to the individuals. And this is a report from the Ministry of Health, right, where and this is a little bit dated, but it can show, I can tell you, we are not at 15,000. So this is where the number of basically these healthcare providers that we had at that point, this was, I think, 2012, and what was recommended for 2016. So you can see we were just looking at, consultants and specialists. At that point in time, we only had 18. There's more trainees in that room that and the individuals who are providing care, right? But, at that point, the Ministry of Health estimated we needed somewhere around 96, but that's still not even enough, right? Because South Sudan, based on, the numbers we see, we have a population of about 11 to 12 million people in that country. Now, you can argue some people have moved on to be refugees, are internally displaced and all that, but the general population is about 12 million people. And so this workforce, about 2,000 odd individuals providing healthcare, is not enough. I just told you that, mental health is one of the biggest problems. I think by last count, and this was when I was in Uganda sometime last year, by last count, they say we have about 4 psychiatrists, right? For a population about 4 million. Imagine you have 4 psychiatrists for a population that is very highly traumatized. What do you have? You have a problem, right? A serious problem. And so as some of you go into, as you're finishing your training, these are some of the things that you can think about doing back home. So what sort of specialty do I choose that addresses some of the acute needs that we have back home? And so that's basically, that's the bulk of my message here is, think about what the problems are at home. We have shortage of trained personnel. And so where do I fit in as an individual receiving this training? And then you see here, this is also data from the Ministry of Health, basically just laying out of the 10 states, how many doctors there are in. So this is also the data from 2012. 248 doctors in the entire country of about 12 million people. And you can see some states only have about, like Unity State here, about 3 doctors for a population about 500, almost 600,000 individuals. I mean, I don't care how good you are as a doctor, as a practitioner, 3 can't treat 600,000 people. Right? It's you will burn out, and you won't be able to deliver the needed services. So as I conclude here, basically what I would want you to do is, at least my advice for you is build your capacity where you are, and you are in the right place right now, doing all of the right things that you need to do. Think of how you can then contribute to the lack of trained personnel back home, and then network. I can't stress that enough. I think Akwi mentioned that earlier on. Dr. Akwi mentioned that earlier on. Dr. Heber did stress that, and your professor did stress that as well. Network with people. And I'm glad, Alafi and Morocco, I think two of your classmates, your colleagues are part of the Pan-African Organization for Research and Education, POHER, which, this is a group of us, Dr. Aki, Dr. Seth Bloom, was started almost 20 years ago. And our role is to basically support through mentorship young medical students who are, interested in research, interested in being guided. And we've had, I think, maybe 3 or 4 South Sudanese come through this program so far. And I'm really proud of all of you, the work that you're doing. You've added incredible amount of talent, knowledge, and you bring a lot of lived experience to the group. And so that sort of networking is really crucial, because these are the kinds of things that will help you if you want to engage in research. As the professor mentioned earlier on, research is not an easy endeavor, right? It's not an easy endeavor. You have to love what it is that you're doing. Like I said, I was up since 2 a.m. this morning, my time here. And it's because I am deeply committed to that project, and that project really is in the northern part of Uganda, working with mostly South Sudanese refugees, young people who have HIV and are trying to address their mental health conditions and all that. So unless you have a passion for it, you have a love for it, this is going to be challenging for you. So networking, working with people you really enjoy working with. Like I said, some of us, have been friends for 20 years now, and we enjoy each other's company. When we see something that the other person might be interested in, we share. And Dr. Akwi did talk about sponsors earlier on. You have these people who will drop your names somewhere. It's like, oh, we want a speaker. Oh, and I say, hey, I think Frank can give a very good epidemiology talk on the epidemiology of diarrhea in South Sudan. So please talk to him. And that way, at least you're exposing yourself to other individuals who might open some other doors of opportunities for you. And so I can't stress that enough. Like I said, when I was, so research is challenging, and we have all our problems, right? And sometimes you might decide, hey, I want to do this work. And then, you realize events intervene. So one of the studies that I wanted to do was, it was because of the high infant mortality and maternal mortality ratio that we had in South Sudan. I wanted to do this study where we use, chlorhexidine to clean the birth canal to reduce both maternal and infant infections post delivery. And then to do that. And so I had that plan, I had everything lined up, and all I needed to do was just travel home to do that. And then obviously in December, the war started. And so I had to scrap all of that work. And so you will run into a lot of some of these sometimes. It's okay. But then the end of the day, you also have to pivot and be able to carry on with some of the work, to also do some of these things that are going to eventually help your community or your country. So for those of you who are interested, this is another topic that's out there. that you can pick up. Happy to support you in whatever way you can, that you can contribute to some of the work that is going on back home to be able to address some of these problems. And really, I want to thank all of you, the South Sudanese Medical Students Association in Egypt, for this incredible workshop seminar that you've put together today. And I thank all of your mentors and your speakers for really being generous with their time, because I know these are busy people, you know, to take a whole day to come and speak with you. It shows the level of investment and care they have in the work that you do. So I can't thank them enough on behalf of all South Sudanese who who are here, and thank you so much. And I'm happy to entertain any questions, and I think the rest of the panels as well. Much appreciated. And if you have, I've shared these slides with Frank, and if you have any questions, please, you can always reach out to me. Thank you.
Thank you very much, Dr. Nihal. You have really touched very key points in what we can do back home. We're going to wait for questions from the audience we have here. If you have any questions, you can provide. Okay, as we wait for the questions, you've said earlier that we need to acquire skills to undertake the task. As you know, like we're all medical students, so is there something more we can do, like except studying and of course attaining the degree we are studying?
And I guess the others can chime in as well, who are much closer to you there than I am. I think, so I may be preaching to the choir here. Usually the problem is the people who are organizing these events and the people who are in these kinds of meetings are the converted. You are doing all of the right things that you need to be doing, right? You are networking, you are gaining skills. Like some of you are, applying to be scholars on some, some God knows random, I would call them, like POHER, for example. If you don't know anything about POHER, you might not be able, but some of these colleagues that you have taken that initiative to apply for these, to basically better themselves, to gain some of these skills that would be needed. So I would say that most of you who are in here are doing those things and are gaining those skills. Please keep up doing what you're doing. The question is always, who are these others in the margins who are not in this room, right? How do we reach them to bring them so that we can have a broader base of individuals who can contribute to the work that needs to be done? Because this is not an easy undertaking, right? You've seen the numbers. When is it that when we will reach to a place where we think, okay, we are closer to enough doctors who can take care of 12 million individuals? You can't train those people overnight. That's just the fact. And so, but at least those of you who are doing that right now are chipping away at that, and grateful to that.
I would like to thank you very much for your answer. And we would also want to inform you that the number of medical students is actually rising. So I think that's already a good thing to start with, and we hope for the best for Homeland. Currently, I'll invite Alafi Francis. The questions? Okay, you have one more question.
Thank you, Dr. Nihal. I have a brief question. My question is, what are the things that we can do as doctors to stop the high rate of mortality or high rate of the children or the infant dying during the birth period? What are the things we can do? You are the researchers. Maybe you have some idea you have come across so that we can able to know as the student. Thank you.
And if you can give me the names of the individuals asking questions, so that at least I'll try to remember names. But thank you so much for your question. So I think one of the problems that we have in South Sudan is we don't have enough data so we don't have enough amount of research that's being conducted right now to help us guide or inform some of the interventions that we need to do. But as I showed you earlier on, so from this data from WHO, from even from the Ministry of Health of South Sudan, where you can see things like like sepsis, things like diarrhea being again, I'm trying to go back to my being some of these leading causes of why children are dying, right? Or even mothers are dying. And we have techniques for that. So having clean space where women can give birth. So like, I think some of the statistics that I didn't show here is that only about 10% of the births are being attended by somebody who has some level of training, whether it's midwife or whether it's a clinician who has that. So really, that can be addressing those cases where, is it possible to have facilities where babies can be born, where they are taken care of, all the delivery is done by trained individuals. And so that's a start. And this is where you come in, right? You're gaining that training. I don't know if most of you will end up being OBGYNs, but we still need for other things, right? We need neurologists, we need GI doctors, we need all kinds of cardiologists and all these other problems that we need. So I think the problem is massive, but addressing some of these problems, the low-hanging fruits. Can we train enough midwives? Can we train enough, individuals who can, or can we even build enough facilities where women can deliver in a safe sort of environment? I think those are the kinds of things that we'll do. But like we said, our work also needs to be guided by data, and so that we can design this evidence-based interventions so as to address some of these problems. And Professor Hebert can chime in, please.